Hi guys, I'm going to do a little series on the history of maternity care in Singapore. So I will start with a first video where I'm going to talk about how the colonial administration saw the bidan. So the bidan is a traditional indigenous Malay birth attendant, or also known as a traditional midwife. So this first picture is a postcard from 1913 of a Malay kampung. So you can see these were generally the kinds of houses that they lived in, which is a wooden house. On you see the second and third house, they're on stilts, but the first house seems to be on the ground. The roof is covered in straw or leaves, and there's a compound, like a common compound outside. You can see there's a laundry line with sarung being hung on top. There's a pile of coconut shells, which would have been used for kindling fires. You also see palm leaves, leaves, coconut trees all around the compound. You can also see for the first house on the left that a fence appears to be made out of leaves as well. So you can see in this housing settlement or this kampong, this village, there's quite a lot of space in between the houses. The living area is also spacious and airy. It's not something I would describe as being crowded or stuffy. So that if yeah, just keep that in mind for when we read through some documents later. So what is a bidan? As I explained just now, this is a indigenous specialist of midwifery, where how they train is usually through apprenticeship, and there wasn't a formal way of learning. So normally it would be something that is passed on through the family. For example, if a grandmother was a bidan, then if she had daughters, then one of them would also follow in her footsteps. Or sometimes it may skip a generation and be taken up by the granddaughter. But what women describe is that they felt a calling to this profession. So just like the indigenous massage specialists or the tukang urut, they also describe that their gift is something from God, and it's a calling that they feel inclined to answer. The bidan also serves many other social roles in Malay society. So, for example, she also works as a mandam, which is nowadays that's just a makeup artist, but previously they also perform rituals to make sure that the bride is radiant and is pure. They also give out some magical. So if you see my other video on Khatijah Terung, so they can give out like spells or diagrams or certain protective charms or amulets for pregnant women. For women who are unmarried, they may also give some obat pengasih, or which we would translate in English as love potions, to help them in their courtship or finding love. And they may also give advice, marital advice to married women. They may give abortifacients or herbs to induce abortion. Some also may also have knowledge on how to perform abortions with herbs and certain plants. From what I've read, there was one method of inducing abortion using green papaya and the twig of a ceraka merah tree. Okay, I won't describe how you do it in case one of you wants to try it, and then yeah, who knows. So those are some of the other social roles that she played in Malay society. Some of the tools of her trade would be spices and herbs, as I mentioned. Jampi, mantra, supplications, and petua. So jampi and mantra are chants. Supplications would be the Islamic side of it, certain dua, and petua are the old wives' tales. So, for example, like a pregnant woman should not sit in the doorway of a home, or she should not sew things, because symbolically making stitches or knots with the thread is akin to making her labor complicated. Or to not, I think one of the petua is that her husband should not hunt, especially when she's in the last trimester, because like hurting other animals could cause her, like as the pregnant wife, to also be hurt. And then especially for a pregnant woman, that she should have her cravings fulfilled as much as possible. Like the husband should try and make sure she gets to eat whatever she wants to eat. And then also that she should take care to not be frightened or scared by anything, because then the baby may take on the appearance of the thing that scared her. For example, like a monkey, the child might look like a monkey, or if she was surprised by a cat, then the child might look like a cat. So for her qualifications, like I said, she obtains this through apprenticeship, and often she starts working well after she's had children. So having children herself is part of her qualification, and normally she would start work in her 50s. So that would be near menopause. And her job was to take care of pregnant women. So from usually around the 6th or 7th month, well, back in those days, then they would find the bidan kampung and let her know that they would like to use her services. And then she would take care of the baby, of the mother and baby during childbirth and in the postpartum period. So the 40 days after postpartum, or what in Malay we call dalam hari. So there's a confinement period, 40 or 44 days, doing things like making sure she's warm, making sure she eats enough food and adequate food, and that she does also certain rituals like massage and belly wrapping and roasting, which is to be put near a fire. Like a fire should always be lit near her to keep her warm, and many other rituals. So in the colonial documents, the bidan were portrayed in a very negative light. So for example, here we have the Strait Settlements medical report from 1915. They were described to have very bad and septic habits. So this phenomena of the high rates of neonatal tetanus, especially, was blamed on the traditional bidan. So the bidan who were not trained. So later on, there were some training programs done for bidan. I'll cover that in another video. So neonatal tetanus is when the umbilical cord is cut by an instrument that is not sterile. So for example, a dirty penknife, rusty scissors, a spear, broken glass, or sliver of bamboo. Other methods were using unsterilized thread or a strip of bark, and then after the cord was cut, they would apply herbs like turmeric, lemongrass, the burnt buah keras powder. Buah keras is candle nut, or use their own spit. So Birch was a colonial medical officer. So in his report from 1909, he described that they were invariably filthy, and they had performed countless evil deeds. So we'll see in the next video what did the colonial administration do to deal with this problem of the bidan, whom they saw were the main cause of the high infant mortality rate and high maternal mortality rate. Okay, see you in the next video.